Can we actually increase penile length? And if so, what methods have been scientifically proven to work? There's a ton of information online, and it's hard to separate myths from reality. So today, I'll go over what science says about this topic and break down some methods that may work, as well as those that don't. And then finally, some advice on what you can actually do to help with your concerns. Hi, dear viewers. It's Dr. Fiona, a sexologist and a urological surgeon. If you're interested in urological content, please subscribe and share my channel with the ones you care. So, before discussing methods, let's understand a bit about penile anatomy. During puberty, the body goes through changes, largely driven by hormones like testosterone, which impact growth, including penile length. However, after puberty, penile length generally reaches its maximum size and doesn't continue growing naturally. This is why methods to increase length after puberty are challenging and typically require specific approaches. Alright, so before we dive into the details, let's start by discussing the average length. Urologists typically measure penile length using a method called stretched penile length, primarily for research purposes. This involves stretching the penis to its maximum length and then measuring. On average, this stretched length is around 5.2 inches. Now, please understand that it's an average, meaning half will longer and half will be shorter. So, what's out there? In terms of solutions? There are some methods that don't work, such as pills, lotions, or supplements. Promising dramatic length increases have no scientific basis. These products are often marketed without medical evidence and can sometimes have harmful ingredients. So, save your money and avoid these products as they won't help with enlargement. Another commonly discussed method is penile exercises, often referred to as jelqing. This technique involves using a hand-over-hand motion to move blood from the base to the tip of the penis. However, there is no scientific evidence supporting jelqing's effectiveness in lengthening the penis, and it can sometimes result in scarring and discomfort. A similar approach is the use of penile traction devices, which gradually stretch the penis over time. Some small studies have indicated slight length gains with these devices. The downside is that they can be uncomfortable and typically require daily use for up to 6 hours over several months to see results. Penis weights are another method that some people try, aiming to use gravity to achieve stretching. However, again, there's no scientific evidence to support their effectiveness. Now, what science says about penile lengthening? Well, scientific studies on penile enlargement have found some methods that may offer slight increases, while others can lead to injury or even worsen sexual health. Any claims for dramatic length increases should be viewed skeptically unless supported by credible clinical studies. So, let's go over some of the methods that do have scientific backing. First, traction devices. Traction devices are one of the few scientifically studied methods for penile lengthening. These devices work by applying consistent, gentle stretching to the penis. Over time, this may stimulate tissue expansion, leading to slight gains in length. Now, some studies suggest that using a traction device for several hours a day over a period of months could result in an average increase of about 1 to 2 centimeters. However, it requires a strong commitment, as results are gradual and require consistency. But after using all of this for like a couple of months and then in the end you get only few centimeters. So you tell me, is it worthy? Alright, so there is another common method is vacuum pumps. These devices use suction to draw blood into the penis, making it appear temporarily larger. While vacuum pumps are generally used to help men with erectile dysfunction, but studies have shown some effectiveness in achieving temporary gains in length. And then there is procedure of cutting the suspensory ligament at the base of the penis. This surgery allows the flaccid penis to appear longer, as it's no longer anchored as tightly to the pubic bone. However, a significant downside is that it can lead to instability of the erect penis. Then there is fat transfer. Now, this is more commonly used for increasing girth rather than length. Fat from other parts of the body is injected into the penile shaft, but results may vary, and the effects are often temporary. The fat is also reabsorbed over time and disappears, so the enlarging effect also decreases with time. Some surgeons may offer silicone implants or injections as options. However, these procedures are highly controversial and can be risky, so they are best avoided. So what should you do if you're unhappy with your penile length? Studies show that men are often more concerned about their size than their partners. So, communicate with your partner. If you can understand your partner's needs, then you're likely to improve your sexual relationship much more than you would by just simply changing the size of your penis. So, another key factor is maintaining a healthy weight. And do you know, for every 30 pounds gained, men can lose about an inch of visible length. By shedding excess weight, you may regain some of this lost length, making a noticeable difference. And lastly, manage anxiety. Now you may be wondering, how does that even make sense? How is anxiety tied to how long my penis is? Well, the smooth muscles of the penis are what we call under adrenaline control, and what that means is that when you have high adrenaline, like you're stressed or anxious, your muscles will squeeze, causing contraction of the penis. In fact, I've seen people with anxiety who come in and complain that sometimes their penis will shrink into their body and ultimately over time will go back to normal. So working on reducing anxiety and stress in your life can overall help relax those muscles and can increase the length of your penis. Alright, so to sum up, these are different methods and surgeries that can lead to slight increases in penile length, but they're not without effort or risks. It's essential to set realistic expectations and to consult a healthcare provider before trying any method. And please remember, embracing body confidence can also make a big difference in your relationships and personal life. So, thank you for watching. If you found this video helpful, don't forget to hit the like button and subscribe for more content on urology, sexology, bladder health, relationships, and much more. If you have any questions, feel free to ask in the comments down below. I'll see you next time and have a good day.